Hi everybody, my name is Dr. Daniel Roney, and if you suffer with peripheral neuropathy, the information that I'm about to go over and the understanding of that information is absolutely critical for you to get better. Okay? Without this information, I promise you, you'll have very little chance of getting better, because what I'm about to go over is just not understood with the treatment of peripheral neuropathy, and it's not being applied. So if you take a couple minutes and just listen, I promise you at the end you'll be happy that you did. Okay? So let's get right into it. A couple things you absolutely need to know is that, number one, peripheral neuropathy for most of you can absolutely be helped. But again, the right things have to be done, and they're just not being done. Okay, number two, what are those things? Well, let's look at some of the causes to neuropathy. And this concept is very, very important in that what I want you to understand is that your neuropathy has causes or a cause, but more than likely there's multiple things going on in your body that's causing your nerves to become damaged and fire off irregularly, creating the symptoms of neuropathy: tingling, numbness, burning, stabbing, difficulty walking, difficulty sleeping, cramping, etc. Those are the signs of peripheral neuropathy that are being caused by certain things. Now, what are those things? This is key, okay? Number one, most important thing to understand is your neuropathy has four underlying fundamental causes. Number one, lack of oxygen to the nerve cells. Number two, lack of blood supply to the nerve cells. Number three, lack of energy production in the form of something called ATP, and that's not happening, excuse me, with you when you're suffering with neuropathy. And number four, chronic inflammation. So let me repeat those. If you have neuropathy, guaranteed you have lack of oxygen, lack of blood flow, lack of energy production for the cell, and chronic inflammation. If those four things, even if one of those four things are going on, but most of you have all four of those things going on, if those things are going on, your cells are becoming damaged and dying faster than they can be replaced. Now, obviously nerve cells we're not replacing, but cells in your body in general, that's what's happening. So when you have lack of oxygen, lack of blood flow, lack of energy production, and chronic inflammation, those nerve cells don't have a chance. They're going to become damaged and start creating symptoms. The more damaged, the more symptoms. So, another big point, neuropathy is progressive because those four things are rarely, if ever, addressed. Okay? They have to be addressed. Now, back up a second. So those four things, lack of oxygen, blood flow, energy production in the form of ATP, and inflammation, where do they come from? Well, most of you have a combination of what I'm about to talk about. These different diagnoses, if you will. A lot of you have anemia. Okay, anemia is lack of oxygen content in the blood, and that will cause cell death, neurons or nerve cells. Number two, most of you have glucose regulation problems. Now that could be diabetes, but it also could be something called insulin resistance or hypoglycemia. Now let me state this pretty clear. Glucose is needed in order to, in something called the Krebs cycle, okay, not to get too technical, in the form of cellular respiration, in order to make ATP. ATP is where your cells, what your cells use for energy. So if your glucose is not regulated right, and I promise you most of you are not having proper glucose regulation, okay, treating hundreds and hundreds of neuropathy patients, I can almost assure you of this. You're not making proper energy for the cell. Okay, if that's not happening and you have a lack of oxygen, you have no prayer. Your neuropathy is going to be progressive, and it's not going to get any better. It's only going to get worse. Now, combine that with a lack of proper blood flow. And again, some of my patients, matter of fact, most of my patients have said, Dr. Roney, I've had a Doppler ultrasound, they've checked my arteries, they're clean, they're doing well. Well, we're not talking about the major arteries. We're talking about the branches of the branches of the branches that feed your small sensory nerves deep into the tissues, okay? I can promise you, if you have lack of oxygen and lack of ATP production or energy production, you're not getting proper blood flow to those nerves, okay? And that's a huge problem. So most of you have those three things going on, And again, most of you also have chronic inflammatory reactions. Now that could be from chronic infection, autoimmune conditions, that could be from a myriad of different reasons. So the main ones, chronic infection and autoimmune conditions for sure. But there are other reasons why you can have inflammation in your system. Okay? Now, backing it up again, if those four things are going on, lack of oxygen, lack of blood flow, lack of energy production, and excuse me, also chronic inflammation, and no one's looking at your anemia or your blood glucose regulation or your autoimmune condition or your chronic infection or your stomach acid issue. I mean, I'm getting into some things that, we can get into further, but if those things are going on, plus brain imbalances, neurological imbalances that most of you have, creating balance and coordination issues, if those conditions are going on and they're never addressed, and I can promise you, I have yet to see a clinic that will address these things. I see a lot of clinics that will use modalities to try to help your pain and discomfort, which I'm all for. I think that's absolutely necessary, but that's a short-term plan. Something like a laser, or there's another highly touted modality that's basically an electrical stim device, okay, that helps the nerves for sure. Lasers will help, anodyne therapy, things like that will absolutely help, but it's short-lived because if the lack of oxygen, blood flow, lack of energy production, as well as the chronic inflammation is not addressed, and the way you address that is make sure there's no anemia, make sure the blood glucose is regulated, make sure there's no autoimmune condition, make sure there's no brain imbalance, make sure there's no chronic infection. And most of you have those things. They're just never looked at. So if they're looked at and they can be regulated and or treated, right away you should be thinking, wow, maybe my neuropathy can get better. Why? Because now your blood flow will be better. Your oxygen content will be better to the nerves. Your ATP or energy production will be better, and your inflammation will be less. Now there's a lot of things that have to be done in order to do that, and for the purposes of this video, we're not going to go in depth. The purpose is to let you know there's hope and to show you what the causes are, okay, that are not being addressed. I promise you they're not being addressed. A lot of clinics are doing modality type of work, which is great, it helps, but it's not going to correct the problem. Or not going to help it long term, because fundamentally the causes are not being addressed. The causes of the oxygen deprivation, blood supply, lack of energy production, chronic inflammation, those things are just not being addressed, and they have to. And that's your golden ticket right there, okay? Now, let's go a step further, because there are other causes. Mechanical issues of the spine are absolutely a contributing factor with most of you. What do I mean by that? A lot of you have disc degeneration, degenerative changes in the vertebrae. You'll have stenosis, which is narrowing where the nerve comes out, facet arthrosis, etc. Most of you have some type of mechanical issue going on in the spine, but also you may have it down in the feet as well. Drop foot, lack of arches, things like that are also a contributing factor. So mechanical issues most of you have, all right? Also, just to take it a step further, most of you have brain imbalance, a brain imbalance or multiple brain imbalances. What I mean by that, there's something called, and not to get into it too technically, an overfiring mesencephalon that can occur, as well as a problem in the cerebellum. If you're not getting proper sensory input to the brain, okay, so you have neuropathy, can't feel your feet real well, can't feel where your foot is being placed on the floor, okay, that's proprioceptive input. That's sensory input to the brain, and more specifically the cerebellum. If that's not happening on a day in and day out basis regularly, your cerebellum starts to weaken. Your cerebellum is responsible for balance mainly and coordination. Most of you have balance and coordination issues secondary to neuropathy. All right. There could also be other contributing factors to that cerebellar issue as well, or the overfiring mesencephalon. So all these things have to be looked at and addressed because they are causes to the neuropathy. Again, lack of blood flow, energy, right, production, oxygen, chronic inflammation, guarantees for most of you. Number 2, mechanical issues, guarantees for most of you. And number 3, brain imbalances. So if there's a clinician out there that's addressing all of those, God bless you, then stay. You're doing exactly what you need to be done based on every bit of research that's out there right now on neuropathy. Okay? But if you're not, then there are shortcomings. Okay? And don't listen to me. Go do the research. It's out there. And what I want you to understand is that if these things are done and no rock is left unturned, you have a phenomenal chance of getting better. Okay, but when I can tell you, I've been doing this for a long time, it's rarely done, and it took me a long time to figure this out as well. But now we not only get phenomenal results, and you can look at our testimonials for that, or you can call the office. We'll give you a full list of people to talk with. But not only do we get great results short term, now we get great results long term because we have given the patient the tools in order to maintain their proper oxygen flow, proper blood supply, lessen their chronic inflammatory response, right? Create proper ATP production for their cells. If they have the tools to do that long term, number one, the neuropathy slows down or even stops, and then with the right therapies now, because there are other treatments that we need to do possibly for you that help reverse the damaged nerves, and that's done with frequency, timing, and duration of proper stimulation. And that's a whole other ball game, but for intent and purpose of this video, this was just designed to give you clues so you can compare and contrast different therapies or programs out there. But make no mistake about it, the underlying causes have to be addressed. Okay? I hope this was helpful. If you need more information, click around the website. Feel free to do as much due diligence as you want. But you'll find on the right-hand side that we'll offer 2 free visits, okay, and that's not going to last very long, as well or more information. Okay, so fill that information out and or call us immediately. You can call us at 714-241-9355. But nonetheless, I wish you the best of luck, and I hope this was helpful. Because again, those causes have to be addressed, and most of you have a combination of many of them, okay? So it's rarely a one cause, one cure situation here, okay? All right, wish you the best. Anything I can do for you, I'll help you in any way I can. Okay, thanks.